SHPA's Don't Rush to Crush is Australia's essential guide to safely giving oral medicines to people with enteral feeding tubes or swallowing difficulties. It is a comprehensive reference for Australian pharmacists and nurses to support best clinical practice, and it is a Pharmacy Board of Australia required text for pharmacists. For pharmacists, Don't Rush to Crush will help you make sure that the medicine provided is safe and appropriate for your patient or customer. For nurses, it will help you safely prepare and give a medicine to a person with an enteral feeding tube or a swallowing difficulty. This presentation will show you the information that is available in Don't Rush to Crush, plus we will show you the new features in this latest 4th edition. Don't Rush to Crush is made up of 2 sections, a front section that contains important general information and an alphabetical list of monographs. Each section of information about one medicine is called a monograph. The front section contains general information about things to consider before you modify a medicine, why crushing is always an option of last resort, how to interpret the information in the monographs, and how to prepare the medicines for people with enteral feeding tubes or swallowing difficulties. Most of the monographs are listed alphabetically by active ingredient name, but at the back of the book there is a separate section for antiretrovirals or HIV medicines and the hepatitis C antivirals. Now let's look at a monograph. This is the monograph for escitalopram. A list of all the available forms and strengths is given here, including the brand names. The quick guide section includes icons that give you a clue as to what options might be suitable for each form of the medicine. The quick guide might also warn you if the medicine poses a potential occupational hazard. You can see that escitalopram is available as a liquid and a tablet, and we have 3 icons here, one for the oral liquid, one showing the tablet dispersing in water, and one for crushing. Each icon corresponds to a specific method of preparation, and you can find a detailed explanation of each icon in the front section of the book. The monograph provides information about the medicine that might be relevant to people with enteral feeding tubes or swallowing difficulties. This section of the monograph will tell you how food affects the absorption or tolerability of the medicine, where the medicine is absorbed, safe handling advice, and information to help you if you have to switch dose forms, for example, switching from a modified release tablet to a plain tablet, or from a tablet to a liquid, as well as if there are other forms available like a transdermal patch or an injection. There may be relevant side effect information here too, like some medicines that cause dry mouth, which can affect swallowing ability, as well as information about what might happen if the drug is stopped or if a dose is missed or delayed, and this can sometimes happen if it takes some time to work through the best options for a particular medicine for your patient. Each monograph gives 2 sets of options, one for people with enteral feeding tubes and one for people with swallowing difficulties. For escitalopram, there are 3 options for people with enteral feeding tubes and also 3 for people with swallowing difficulties. The options are listed in order of preference. However, it is up to the individual to decide what will work best for the person in your care. Options are not always the same for enteral feeding tubes and swallowing difficulties. An oral liquid is usually the best option for a person with an enteral feeding tube. Directions are given here to dilute the dose with water, and this is because most oral liquids have a high osmolarity and they will cause cramping and diarrhea when given directly into the tube. Diluting them with water reduces the osmolarity and makes them better tolerated. Some liquids are a bit thicker than water, so diluting them will also help the liquid pass through the tube without clogging it. Option 2 is to disperse the tablet. That means placing the tablet in 10 to 20 ml of water in an enteral syringe and allowing it to break up into a dispersion with gentle shaking or stirring. There is information about how long different brands take to disperse. Method A is a step-by-step list of instructions that show you how to disperse a tablet for administration into an enteral feeding tube. There are 6 different methods of preparation and administration described in Don't Rush to Crush, and you can find them listed here on this handy insert at the very front of the book. Always make sure the tablet is completely dispersed before giving it into the tube, because pieces of the tablet can block the tube. Gently shake the enteral syringe to make an even suspension just before you give the dose. Option 3 is to crush the tablet and refers you to Method B, where step-by-step instructions are provided. Crushing is usually the last option. Dispersing a tablet is usually recommended before crushing because you lose more of the dose through crushing. If a tablet doesn't disperse easily, or if we don't have any information about dispersibility, then it may be necessary to crush it. Make sure you rinse the crushing device twice and rinse the enteral syringe so you get as much of the dose as possible to the person. By flushing the tube before and after giving the medicine, it will help avoid tube blockages. One of the biggest risks with any modification of a tablet or capsule is not getting the whole dose. Even with the best technique, some of the dose will be lost to the equipment, and it can be as high as 24% if technique is poor. So regardless of which option you decide is best for your patient, make sure you follow the instructions as they are set out in the methods. The 4th edition is the latest version of Don't Rush to Crush. It is not safe practice to use out-of-date references or guidelines, so make sure that you have access to this latest edition of Don't Rush to Crush. Look for the large number 4 on the cover. To purchase, visit shpa.org.au/bookshop.